Hello, everybody. Welcome to this week's episode of Step into the Pivot. I am so excited to be here. This is Mental Health Awareness Month, and I love having conversations with amazing people, women especially. So, Xiaojue Hu is here with us today. So, Xiaojue, I am so excited to meet you and to hear what you have to share with us. So, thank you for being here today.
Yeah, thanks so much for having me. Yeah.
So, you're a psychiatrist based in New York City. You're working on some psychedelic clinical research at the New York University of Medicine. I think that's some amazing stuff. And I know you're also trained in something called focusing. Evie, I think you're going to get a little more into some of these specifics. So, I'm going to turn it over to you.
Thank you, Teresa. And Xiaojie, welcome to the show. It's so great to have you here. And I'm going to keep doing the same thing. I'll say, well, I'll let Xiaojie tell us more because that's actually part of her pivot. So, talking about your background and talking about what you do for a living is really, the conversation about you stepping into the pivot. And I am so glad that you and I met now several years ago, right post pandemic, which was also an interesting
Mhm.
time. We met in Greece, as a matter of fact, where both of us signed up for this retreat like conference, women's convocation. And we didn't know each other before. But as soon as I saw you, I started to feel really connected. It was so easy to talk to you. And I realized that you have this beautiful way of, talking shop, talking, science, but also talking the spiritual side of all things mental health, wellness, women's issues. And it was just such a joy to have that conversation with you away on the island of Crete. And now we're going to have that conversation here on Zoom. So, without any further ado, because if I keep talking, I'm just going to keep like basically discussing your pivot. And that's not my job, that's your job.
Uh-huh.
Can you help us anchor these elements that we just highlighted? So, psychiatry, psychedelics, I mentioned
Mhm.
spirituality, mental health month. Tell us about your professional training and then help us understand how this actually, shapes you. Who are you? Pun totally intended. Tell us
Yeah,
about
thank you
you.
so much. Yeah, thanks for the amazing introduction. So good to be here. In terms of my training, as a psychiatrist, I was trained in a pretty conventional way. I went to medical school and undergrad at Brown University, and then I did my adult psychiatry residency at NYU or New York University, and a fellowship in psychosomatic medicine, which almost sounds like it's like fake medicine, but it's just about the mind body connection. Um, and yeah, something really strange happened to me in my fourth year of psychiatry residency, which actually is about exactly like 10 years ago. We're recording this in April, and this literally happened in like April 2015. And just to give context to that, I was raised atheist. My parents are Chinese from communist China, and I did dabble in like Christianity as a teenager, which is some sort of like weird reverse rebellion because I know people often like go the other way. But um, I think in retrospect, at the time, I got into that briefly because of the spiritual hunger I was feeling to kind of connect to something spiritual, something with deeper meaning. I quickly became a bit disillusioned with organized religion. So I didn't even think about, God or spirituality or anything for years until my fourth year of training. And I still don't really know how this happened, but it like happened within a few weeks where I kind of went from somebody who, didn't really believe in anything. And maybe I might even have been someone who like made fun of people who, did yoga meditation or had crystals. And ironically, now I do all three things. But within a few weeks, I just felt this inner passion or openness and deep thirst to kind of learn about everything spiritual. I was like really open to believe in that realm where I wasn't at all before. And I still don't really know like what triggered that. The only thing I could think of was I did start meditating just for a few months before but it was pretty low key. It was like 20 minutes a week or something. Although I guess it is good to know that even meditation is not without its risks, aware of consciousness expansion. And so, yeah, it was also strange because during that time, I also came across some books on psychedelics. And of course, as a nerd, books are like my gateway drug to, psychedelic drugs. And, Michael Pollan hadn't come out with his book yet. So I had read DMT, Spirit Molecule, by Rick Strassman, which is about experiments where they gave DMT to different people and kind of documented what their experiences were like. And another book by Daniel Pinchbeck called Breaking Open the Head about his experiences with different psychedelics like ayahuasca and iboga, which I had never even heard about at that time. And I just suddenly became super obsessed with psychedelics at the same time as spirituality, which I don't think is a coincidence because what kind of really drew me to that at the time was they seemed like these medicines or substances that really help people connect to the spiritual realm, and the types of healing and transformation that some people seem to be able to have with these plant medicines were just far greater and deeper than what I was seeing on a day-to-day level as a psychiatry resident, using conventional treatments. So yeah, so that really like helped me shift what I was really interested in at the time.
Wow. And so you talk about this spiritual opening, right? Like you talked about that. I'd love to hear a little more about that and how that um, brought you to things you maybe didn't see before and maybe changed, right? Talk a little more about how that like kind of made you see things you didn't see before and maybe how that changed your direction, right? Because that's really a big change, a big pivot from what you were thinking before, from what you said.
Right. Yeah. Great question. I think it just kind of expanded what I thought was possible and what I was aware of. Um, and, just as a caveat to, what do I mean by spirituality? I mean, it doesn't really need to be anything super fancy or super mystical or complicated, but, it could be as simple as, like that sense of awe or magic that you feel maybe when you're in really like beautiful nature, or when you've experienced like a moving piece of art, or, when you feel like you're connecting to your intuition. Or something like that. Because I know different people have different feelings about words that people might use in the spiritual realm. Um, and yes, I think it just helped expand my perspective on, well, what do mental health conditions really mean in that context? And so, I was trained with a more biomedical paradigm where, everything is seen as sort of like a disease with a really physical basis, a cause, and usually to treat that disease, you need like a medication or other kind of modality to correct the physical cause. And, in psychiatry, people also think about the psychological and the social, but nobody definitely talked about like a spiritual context. And I think having that lens helped me to think about, well, what is the sacred context for these conditions that are now, for better or worse, becoming more and more prevalent, like anxiety, depression, PTSD. Are they all like diseases? Are they, signs that there's something wrong with us? Or is there maybe a deeper meaning to the suffering that people are going through? And I know even and I have talked a little bit about like the descent journey. And I heard you mentioned this was talked about in other podcast episodes. So I guess I won't go into too much detail there, but I think that feels like a really nice metaphor to talk about someone's mental health challenge as well. Um, and another metaphor might be that of like the dark night of the soul, which comes from, more Christian mystical tradition, um, or even a more like concrete metaphor would be like a birth or something. And so the way I see it is sort of like, if we see a woman like screaming in pain or writhing, but we don't know that she's giving birth, like maybe we can't see her body or something, we might think that she's like dying or like severely injured or something. But as soon as we know that she's actually giving birth, then that really shifts the whole context of how we see the suffering that she's going through. And so, in a descent journey, for example, there's that process where you're kind of like going down into the underworld or like hitting emotional rock bottom or something, where you're kind of being stripped away maybe of everything that was familiar to you or that you had depended on. that you thought was you or that you identified so closely with, um, until you go through almost like a metaphoric death in a way. And then there's the ascent journey where you're kind of going back to uh, the above world, but you're changed, you're sort of different. And if we're thinking about the birth metaphor, it's almost like you're kind of like reborn. You're kind of giving birth to another new version of yourself. Um, and so I'm using these metaphors because they kind of come from a more spiritual way of maybe seeing or interpreting suffering, which I feel is also helpful in addition to understanding all the physiologic basis of all of these mental health conditions and all the other interventions that we use to target that. Like, I think there's room for both views as well, and it's also important to understand the context sometimes for suffering.
It's so beautiful. One of the reasons I mentioned when we were chatting offline that we've talked about the descent journey on the podcast is actually because the full pivot idea, step into the pivot, is really about these transformative descent journeys. Um, every episode, we essentially touch it because we talk about how, you know, tell us about with our guests on a regular basis, tell us about something that happened to you that likely is something that you didn't want happening. You didn't plan on it. It was unexpected. And typically, we talk about something that was really hard. And then this idea that you're going to, like, in order to fully experience it, you're going to kind of like come into it, be with it. And then when you digest it, metabolize it, process it, transform, you're going to come out another way. So there's going to be an exit point that's not exactly the same as the entry point. And then we'll, in plain English, we'll say, you'll be kinder, more generous, more loving, more capable, more skills will be had, there will be gifts, there will be, knowledge gleaned from this experience, and it will have changed you, and you will be able to say that it in some way it changed you for the better also. And that's not sugarcoating the difficult.
Yeah.
So you're helping us also, bring in some additional understanding when it comes to, people's the other episodes that we've had. That's really beautiful. But you also work with the population that, some of our guests don't. Can you give us some examples from your work of exactly what you're talking about? And then as we're thinking about May and mental health, month when, a lot of challenges um, get discussed too, give us some examples from your work that
Yeah.
resonate with you.
Yeah, yeah. Well, as a psychiatrist, often I do work with people with, maybe more severe mental health challenges. And so, um, I definitely don't want to minimize, like, sometimes,
Yes.
say, if you're in a state where you're really suffering and say you're like so depressed, you can't even get out of bed, you're not feeding yourself properly, you can't leave your house, maybe you're having suicidal thoughts or something. And maybe you are not, thinking about like the descent journey and how helpful is this metaphor? I'm going to become a new version of myself. Like, maybe you're not going to be there usually when you're in that state. And so maybe in that state, that is the time where, you do want to rely more on stuff like medications, or also, therapy. I would say along the entire process probably would be helpful, or at least working with someone. Could even be a coach or a teacher or a mentor. Um, and so, yeah, so I think that it really depends on which stage one is at in the process of healing. So in the more severe stages, I think, there's definitely something to be said about, how do we just alleviate the suffering, acutely. And sometimes that may mean taking a medication, or, in more severe circumstances, if someone is just not physically safe, like, do they even need to be hospitalized or be in a different, level of care? Um, and the way I think about medications is sort of like if somebody broke their leg and they need to have a cast, the medication itself is sort of like that cast, where it's not necessarily doing the actual healing. The body is doing the healing with its own, healing intelligence. But it is protecting the leg, it's protecting the psyche from further injury. And it's kind of, say, if we're talking about an antidepressant, it's giving a floor to how low somebody can feel, even though it also offers a ceiling to how amazing they can feel. But if they're starting out really low, they're usually not as worried about the other side of it, where it could be a little numbing. And so once you're able to stabilize somebody, then they may have deeper capacity to think about like, okay, how did I even get here? Like what are the deeper questions to ask, which, hopefully they can do maybe with the help of a professional, like a therapist or something like that, where they could think about like, oh, actually, I became super depressed right after I had like multiple losses, and maybe it's a lot of unresolved grief that I need to work through. There's really no timeline for grief, um, and I think in our culture there's not a lot of ritual around how do you handle that, and so sometimes it gets kind of put into the bucket of depression when maybe it's also just a really natural mourning process, and it takes some people longer than others, or maybe someone's gone through a lot of childhood abuse, and maybe some of it they don't even remember, and then like they always feel like, why can't I move beyond a certain point in their lives? I'm always having anxiety, panic attacks, nightmares, whatever. And so it's sort of like asking those deeper questions of, okay, what are the roots of some of this suffering? Like, what is that trauma? And with trauma work, often people talk about things like the window of tolerance, like how much capacity do you have to, deal with the trauma? And sometimes the first step is just to stabilize yourself. So that's sort of like the stages where you're at. You always have to meet yourself wherever you're at. Sometimes it's about safety, stabilization, and once you have enough capacity, then can you look at the trauma, or can you look at what happened, and then heal on a deeper level. Yeah.
Yeah, you made me really think about a lot of those things because I think you're really right, right? Like we get to that point and we have to kind of figure out where we're at and make ourselves figure out where we're at so that we can kind of be there and then figure out how to move forward, right? Or how to do that. And you talked about the stages of healing, right? Are there stages? Is there support we can give others when we know that something like this is going on? I mean, I can tell you, I've told Evie this story, right? We have my husband's dad who's 81 years old, and he's just up and down and back and forth. And so you never know when you walk into his house what kind of mental state he's going to be in. And it's a very, it's a very interesting thing with him. Like you try to be gentle with him, but sometimes honestly, he needs a kick to get moving, right? That he's just kind of wallowing in his own. So can you talk a little about support, maybe how we can, and I think my example is probably extreme, but I think a lot of our listeners probably have those types of things, right? We've talked with people who have, parents that they're dealing with and these kind of things and trying to really support them as they are trying to move towards the healing.
Yeah, great question. Yeah, thanks for sharing that. Um, well, I think one thing is to just be aware that sometimes, when someone's going through something, like whatever we're seeing, it's not their whole self, you know. Um, and I see symptoms, not necessarily as things we want to get rid of, even though also sometimes we really want to, relieve the pain, relieve the suffering, or if someone's having a panic attack, maybe, like maybe they do need to take a medication to calm down. Um, but symptoms are sometimes also signals I see as coming from different parts of ourselves that just need our attention. Um, and often what is happening when someone is in the midst of, what we see as something really difficult, maybe they're super angry or they're super depressed, super anxious, is that sort of like almost a wounded part of themselves, but that's not their whole self. I think especially supporting people who are really close to us, it might be really hard sometimes to see them in those states. And so it's really important to remember that's not all that they are, and that they're going through something. And it's important to remember, maybe the deeper parts of who they are. But also, obviously, if we're in the role of giving support or even caregiving, it's really important to connect to or stay connected to ourselves as well. Like, where are our limits? At what point do we need to take a break? In dealing with, what's happening.
I love that you talked about limits because I have this conversation with my husband all the time. I'm like,
Yeah.
you need to have your limits with him. Like you can't, right? Like I love that you talked about that, honestly. That makes me
Yeah.
feel so much better.
Totally. Yeah.
Mm.
Boundaries and self-care are so important. We can't be everything to everyone. That's,
Exactly.
yeah. Yeah.
Exactly.
And I love that you asked that question, Teresa, because, in that context, you are not trained like Xiaojue to provide mental health support. Uh, and yet, you guys are in it day to day and very frequently, and you will be, called
Yeah.
to provide some of that support, even though you don't have the training. So it's
Well,
really
and
wonderful
we
to
would
learn
love,
from experts. Yeah.
yeah. And we'd love for him to go talk to somebody, but he outright
Mm.
refuses, right? Like, so it puts us in a weird spot. Like, you also can't force him. He's an adult. Like, but I know that would do well for him. Like, I know that, but it does. You're right. It puts a lot of pressure on, and I know we're not the only people going through that with parents and other things. I mean, I talk with people all the time, and it seems like that comes up more in conversation than ever. So, yeah.
Yeah.
Yeah. No, I think that's just inherently a super challenging place to be in general. And there's no like fast or easy answers to that. I
Yeah.
think especially with a parent-child relationship, because I feel like whatever it is, it's going to trigger all of your most primitive, biggest things, right? If it's a parent. Um, yeah.
Yeah. Yeah, and I'm thinking back on the comment you made, Xiaojie, about culturally speaking, here in Western culture, we don't necessarily have good systems anymore to help us, to help us shepherd ourselves and each other through some of these deeper, more challenging, emotionally loaded grieving experiences. So, there is no rite of passage, there is no ritual. And I'm wondering if, in that context, psychedelics, do you see them as a bridge between some of these ancient practices of healing and modern situations? Maybe that perspective plays a role. Tell us a little bit about your, interest and how you see psychedelics actually, functioning in as helpers in this whole context that we've been discussing.
Yeah. Well, I see them, I think, they are really useful at certain stages of healing. So I think, it's great for some people and also it has its own risks as well. So I definitely, as a caveat first, have to say psychedelics are not for everyone. Um, but if you have a certain level of stability, I think they can be an extremely powerful tool potentially. And what I like about it is that they have a really holistic approach to healing. So rather than, say, numbing symptoms, which is what a lot of psychiatric drugs do, and there's a place for that, as we talked about, what they do is they amplify stuff. So they amplify all your emotions, they amplify your memories, your thoughts. If you've got some traumatic stuff happening, potentially that would come up in a psychedelic journey. Um, but they don't do that just to punish you or to make you suffer unnecessarily. But often what happens is that it brings things up that may need to be healed, so that you can feel it, so that you can see clearly what the situation is that maybe you have repressed for a long time or just didn't want to deal with. Um, and usually people come out the other side feeling a lot better. And so it kind of targets it. There's a physiologic basis to that as well. There's a lot of studies around, the serotonin receptors that it works on and brain imaging showing how it helps different parts of the brain communicate to other parts of the brain. But it also works on the emotional level, and I would say also on the spiritual level. So what people often sense inside a journey is a connection to something greater than themselves, because there are certain types of pain that sometimes we just cannot bear alone. Like you said, we need we need not only support from other people, we need like a sacred container that can hold some of this suffering. And sometimes we just need a connection to something bigger than ourselves, whatever we want to call it. In 12 step, people call that higher power, or you can even say even just your inner wisdom, or, the universe, whatever you want to call that. Um, Whatever that's bigger than your own, maybe more ego based, limited perception of who you are. Um, And so within a psychedelic journey, people often feel that connection, or they feel like something is guiding them. Some people see it as like maybe God, sometimes they're coming from that belief system. Sometimes they're connected to like, a really much better, more confident, competent version of themselves, or sometimes it's a relative, someone comforting who's like taking them through that journey as a guide. Um, and so I work, on a trial currently using psilocybin to treat existential distress in people with advanced cancer. And often we are talking a lot about people's fears of dying, because that's sort of the criteria to get people in the study. Like, are you really struggling with that? So, of course, the conversations, a lot of them do center around that kind of stuff. And so, what I've seen, and anecdotally multiple times in these journeys, is that people will face their fears of death in the journey itself, and it could be different versions of that. It could be as extreme as they literally believe they're dying right now, like on the couch, even though we all know they're physically safe, but they really believe they're dying, or their fear manifests in other more metaphoric ways, but they're feeling it. But then usually the next day, if they go through that, they usually feel like much, much better. It's almost like the fear has been cleared away or something like that. And so and then another example of healing, where instead of numbing a symptom, what you're doing, you're bringing it forth so you can work through it, so that it could be kind of fully released. So that's like one way that I've seen psychedelics work. Yeah.
Oh, I learned a lot today. So I appreciate that.
Right?
Yeah,
Yeah.
no, I think it's some very interesting, I love the spirituality part of it, and I love how that like kind of comes together. It totally, yeah, I learned a lot. Evie, I know you have something to say.
Well, I was listening to you talk, Xiaojue, and picturing you being really the pivot master in this ability to hold space for other people while they're going through their own pivots. Whether it's someone who is, within a journey and they're, having a massive experience, or it's someone you're treating more traditionally. Here you are being trained to be that sacred container so that people can have these descent journeys. And that's really cool. I really wanted to presence that, because I mean, that's not, you know, um, that's not easy. That must be really, that's a big story for you. So I'm curious if you're tapping into your own spirituality, to take us back to the beginning, your own, spiritual opening, and that pivot, and tell us how it's been a step forward for you. And I'm particularly curious in terms of how you use that opening and your own spirituality to help, resource yourself as you keep showing up for people while they're going through something, that can be as difficult as what you described as existential distress.
Yeah, thank you for that question. Well, everything I'm talking about in terms of like how do you deal with challenges, that, it applies to me as much as it does to my clients. For me, I also have to keep in mind like there is meaning through whatever suffering that I'm going through. Um, and so, yeah, I do feel like having a spiritual perspective definitely helps with resourcing, connecting to something bigger than myself. So also breaking out of the paradigm that I was trained in, of the doctor being like the expert and the authority, and then the patient being like this passive receiver of like, okay, I've got to do what the doctor says. But rather going back into that like birth metaphor, where I'm more like the midwife and I'm here to support a process that's already naturally happening for the other person. But how can I support that? So it's not just on me and just based on my skills and whatever wisdom I have, but it's also like, how do I connect them to their inner wisdom? There's that faith that everyone has that inside of themselves, no matter what they might look like on the outside. And how do I give them as much power as possible back to them? So it's not like they're asking me to save them or heal them or something. It's like, how do we facilitate the natural healing process? That's probably one of the bigger shifts for me in terms of orienting on how to like treat people or hold space with people. But I also like what you brought up, even about how we don't have those containers or rituals for helping people move through suffering. in this day and age. And I think that's a big root of a lot of our suffering too, is that disconnection we feel not only from parts of ourselves, but each other, community, and nature, and maybe even our ancestors, and how maybe, I wonder if facilitating more connection to that can help everyone feel more resourced to hold space for themselves and for people that they love.
Yeah, no. Thank you so much. You gave us so much to think about, Xiaojue. It was an honor, a pleasure to have you here. Like I said, you really made me think. And, this is such an important topic, especially, during Mental Health Awareness Month and things we often need to think about and, be there for others and figure out, some of our own things sometimes. And, it's taking that space, it's taking a step back, it's going further, or thinking about something else, or whatever that looks like. So Evie, do you have any final thoughts?
I love the description of spirituality that you gave at the beginning. I'm remembering when we met, we were doing, as part of the retreat work, a lot of exercises that had to do with mindfulness, mind, body, breath connection. And we would, meditate together and do some other practices. And then we would have free time during which we could go to the beach. And I remember standing there with my feet in the water and looking at the waves and then taking a swim and then hearing the sound of the Mediterranean and just feeling like, wow, there it is, the awe. So yes, one way to access it was through dedicated practice and, dropping in. And I'm using a funny voice right now. I don't mean to be mocking it. That was immensely beautiful too. But then there was this other avenue where I don't know what it is that I'm calling it, but it's not an it. It's an everything. And it was just so beautiful to be in that space of the awe. And thank you for bringing some of that awe here through this episode for us. You're clearly, someone we could talk to for a long time about so many different topics. And I hope we do continue the conversation. And if our listeners are interested in learning more about you, they can also find you online. I know you have an active LinkedIn profile, and we'll link to that in our show notes. Anything else, Xiaojue, from you as we say goodbye?
No, it's been such an honor and a pleasure to be here, and thank you for the opportunity to talk about these topics with you guys. So thank you. Yeah.
Yes.
Thank you so
Thank
much,
you.
Jay. Thank you, Ivana. Thank you to all our listeners today. We were happy to have you here, as we always are. So we will see you in next episode. It'll be out in 2 weeks. And in the meantime, if you have a pivot, step into it.